Welcome back to the morning show. Our show today is brought to you by K&L Telecom. Thanks to K&L Telecom for helping us bring you today's show. And with us now is Dr. Jacob Sinkoff, emergency physician at Henry Ford Jackson Health and IEP.
Yeah, thanks so much for having me back.
How's it going?
It's good. It's busy.
Yeah.
We're busy at the urgent care, busy in the ER, which is good with back to school and all that stuff.
Yeah, summer winding down. People are traveling. I wanted to ask you about Labor Day. I read 137 Americans plan to travel. Does that correlate to busy ERs across the country?
Yeah, and for sure. And people don't think of Jackson as a popular tourist destination, but it really is. Yeah. A lot of our local lakes bring up people from Ohio, Indiana. So a lot of time, even Metro Detroit to some of our lakes, especially on holiday weekends, Memorial Day, 4th of July, Labor Day. We have a lot of out of towners that come in with their injury. So it can be a busy time for sure.
Yeah, so busy is good. Well, if it's your business, but if you're a person.
Yeah, if you're
we
a
don't
visitor.
We don't want to go.
Yeah,
but if we do have to go, we want the care that we have here locally.
We've both been to IEP urgent care many times.
And that's the kind of service we like to provide. It's kind of hard a lot of times, especially in the emergency department. People are seeing us on the worst day of their lives, and we try to bring care and compassion to those people when they come and visit us. And the urgent care, we really aim for more just quick service, and we provide a lot of services at the urgent care, vaccines, testing. Now, one thing I want to talk about with sports physicals coming up, sports physicals can be provided at the urgent care, and it's something we're able to do, provide appointments 7 days a week, 8 to 8.
That's great, yeah. And not everyone, a lot of people do it that rush before fall sports. Not everyone's in a fall sport. You probably didn't get that physical. Easy, make an appointment online at IEP. What about, we've been talking a lot with health department and other doctors about the backup maybe on kids' immunizations. Are we at a little bit of a backup?
Yeah, for sure, especially I think with COVID, kids kind of got lost a little bit by not, family doctors were closed down for a little bit, wouldn't see sick visits. So just kind of like the supply chain with everything that's going on, we saw the same thing with vaccines. So children can get a little behind, and health departments through the CDC, the Michigan Health Department, there's a vaccine schedule that, for children that are behind, they get people back caught up, and I think it's more important now than ever with the news that polio's coming back in New York. So I think now's a more important time than ever to get caught up on those vaccines. So
the state this week issued a report county by county as to vaccination rates for kids, and these are the standard vaccines everyone needs. Like polio and the other range of childhood vaccinations. And Jackson County is at 80%, which is good compared to much of the rest of the state.
Compared to Oscoda.
Oscoda, 30%.
Yeah.
And you're really doing a service, because there's some people because of allergies or medical conditions can't get vaccines. So I know people have become experts on herd immunity with COVID-19 and doing research, but it is an important concept to protect children that for whatever reason, can't get vaccines. Right. So 80% is a good number. We'd obviously like to get it as high as we can, but childhood vaccines protecting against measles, rubella, all that sort of stuff have been along for a while. They're safe, and something that we encourage all children to become a part of, especially with back to school. Flu shots are going to be available, and we have flu shots at the urgent care too. So
perfect.
Yeah, so Michigan being a four-season state, the ER and IEP also 4 seasons. The things that you treat change with the seasons. So what have we seen during the summer, and what do you expect to see during the fall?
So with the back to school, working the last couple emergency department shifts, we're seeing COVID. We're seeing lots of COVID. We're starting to see it in younger children. The good thing is with the COVID on younger children, they're not quite as as sick, usually recover, but they can be obviously a vector to spread COVID-19.
Sure.
So to parents, grandparents, things like that. So just being aware, if your child's sick, getting tested, if they got fevers, kind of COVID-like symptoms, getting tested. So and probably holding them out of school until those symptoms resolve. So we're seeing kind of with the upstart of school, kind of all that stuff coming back, and it's still nice out. So we're seeing kind of bike injuries, all that type of
Yeah, a lot of
thing,
bike
so.
injuries for sure. Now you can't predict how the customers that are coming in, but what's the vibe like? Has it been as packed as it's been in the past over COVID, or are things running maybe a little bit more smooth for everyone, both customers and staff?
So we're almost back to our pre-COVID numbers, maybe about 5% down in the emergency departments. We're pretty much back to where we were kind of pre-COVID. We're working on staffing, but we've been doing much better, kind of just like everywhere. Getting staff is difficult, but we've been doing a pretty good job. So we're working on our throughput as always. Urgent care has been great, especially with the online appointments too, getting in and out. And we've been doing really well with the urgent care.
The appointments in the urgent care was just, life-changing, really. I think it actually changed people's mindset. Maybe they wouldn't even seek care, and then whatever they had would probably get worse.
Yeah, I've had friends that say, hey, can you come and take a look, or my family doctor can't get me in for 3 weeks. I was like, why don't you just make an appointment at the urgent care? They'll get you in today or tomorrow. And they're like, oh yeah, thanks. Like, it's like, yeah, think of the IEP urgent care, for sure.
I did on Sunday.
Yeah, well, it's on your favorites on your phone.
Yeah, I had a bike crash, and I went to IEP urgent care, and I did get an appointment. I got right in. It was an unbelievable service, and so.
Yeah, one thing we pride ourselves is, as we're a company that is kind of based on emergency department physicians, is our staff there are trained in emergency medicine. So, we can provide that type of level of care in terms of emergency level stuff, and especially knowing, hey, you probably need to get seen in the emergency department for further testing, or determine, this is something we can treat now and get you feeling better, and all that sort of stuff.
Yeah, because you have really everything, all the diagnostic tools, digital X-rays, right there, available on the spot, and
And the staff is absolutely phenomenal. I've had to bring my daughter there a few times, many times for COVID tests and sports over the years. And the staff is just so nice, so friendly, so welcoming, and I just want to compliment you guys on that.
That's excellent to hear. A lot of that staff is from the emergency department, whether it's the MAs, receptionist. A lot of the staff came from our emergency department. So we like to promote a culture, and I'm glad that it's noticeable. It's noticeable in the urgent care also.
Yeah, so with kids and COVID, are you able to treat children with some of those new therapies?
The Paxlovid, don't hold me to this, but I believe for young children, unfortunately, we're not able to treat children with this. Like I said, the mainstay of treatment with children especially has just been supportive care. So treating fevers, staying hydrated, and the one good thing out of this is the children don't seem to be affected as bad with COVID-19. So, just kind of that sort of stuff. But it's extremely important to get tested and know that, it's COVID and not we're starting to see just kind of the, normal fall kind of illnesses, respiratory, just viral URIs. So making sure it's not COVID, holding children out of school, keeping an eye on. And that's the other thing for the urgent care. If you just want to get your child checked to make sure oxygen levels look okay, have a listen to the lungs. Very, very important. But we're starting to see all that sort of stuff, but mainly just supportive care, and a couple of days, usually the children are feeling much better.
Do you think we all have had COVID by now?
So I don't know. I've never had COVID.
I
have, or at least not that I know
same.
of.
Yeah, same.
So I don't know if we were. I mean, I've taken tests before. I I'm not like I test every week or anything like that. So I'm sure there's a subset of the population that's probably just naturally immune. there's probably a large subset that had it and were just completely asymptomatic, which is probably what's more likely is we had it, we're just completely asymptomatic. But yeah, it's never come through. My wife hasn't had it. My 19-month-old hasn't had it yet.
Yeah.
Exactly. That's why you guys
Well,
have
I've
a
had
wooden
it,
set.
Yeah.
Yeah. So, but I think it's probably that most people have had it. We're just asymptomatic would be my guess.
Great. Thanks for all the updates. Good to see you.
That's
Yeah,
good to
thank
see you
you.
guys too.
Yeah.
Thanks for having me.
Dr. Andrew Sinkoff, emergency physician with Henry Ford Jackson Hospital and IEP Urgent Care. Stay tuned. We'll be meeting the new team member of the Jackson Recreation Department after this.